Hello, my name is Andrei Filippov, and my topic is Transcatheter Mitral valve repair in patients with heart failure. Definition: mitral valve insufficiency, also called mitral regurgitation or mitral incompetence, is a condition in which the mitral valve of the heart does not close properly, which causes the blood to return to the heart. If the mitral valve is considerable, the blood cannot circulate through the heart or to the rest of the organism efficiently, which causes fatigue or shortness of breath. TMVR, particularly edge-to-edge leaflet repair, is a well-established alternative for patients with severe primary mitral regurgitation, considered at high or prohibitive surgical risk. More recently, transcatheter mitral valve replacement has emerged as a potential therapeutic option for the treatment of the severe MR. TMVR may offer some advantages over transcatheter repair by providing a more complete and reversible MR reduction.
My name is Matthew Chung, and I'm one of the structural and interventional cardiologists here at Virginia Cardiovascular Specialists. And in this video today, I'd like to discuss MitraClip or transcatheter mitral valve repair to treat severe mitral regurgitation. Mitral regurgitation can be identified in a number of ways. Sometimes it's when a patient's doctor hears a murmur and then they obtain an echo which demonstrates that they have a leaky mitral valve. But oftentimes it becomes noticed because of symptoms. And so the symptoms of mitral regurgitation are very similar actually to the symptoms of aortic stenosis. And so these would include things like fatigue, problems breathing or shortness of breath, and also patients can develop symptoms of heart failure. Mitral regurgitation can happen for a number of reasons, and we kind of put it into two different categories. One is when the mitral valve itself degenerates. Over time, as it opens and closes with each heartbeat, the valve itself can become thickened and the support structures of the valve can degenerate and the valve itself can become abnormal. And when that happens, you can have a leaky mitral valve. More recently, studies looking at patients that have a normal valve, but the heart itself is weakened to the point where it can no longer support adequate closure of the mitral valve. And this is a group of patients with what we call functional or secondary mitral regurgitation. We do this procedure under general anesthesia. Once the patient is asleep, we put a catheter into the vein in their groin, and then this is how we deliver the device to the mitral valve. When this becomes severe and a patient is symptomatic, we can use the MitraClip to repair that valve. So MitraClip is a catheter-based technology that allows us to repair the mitral valve in patients that have a leaky mitral valve without having to do the traditional route of open chest or open heart surgery. Basically, a glorified clothespin that we place on the mitral valve to help bring the leaflets together. The procedure itself typically takes an hour to maybe 2 hours depending on the complexity of the mitral valve disease. And then the patient is monitored in the hospital, typically one night, and the next day if they're feeling well and things look good at the access site and on an echocardiogram, then they'll go home the very next day. And so after these procedures, patients can really go back to doing whatever they'd like. In a week's time, if they want to go for a walk, if they want to go to the gym and exercise, they can really do these things and enjoy them.
Applications in medicine. In patients with heart failure and left ventricular dilatation, mitral regurgitation may develop as a result of the geometric dislocation of the papillary muscles and coordinated in an impaired coaction of the mitral leaflet. Such secondary functional mitral regurgitation increases the severity of volume overload and has been strongly associated with decreased quality of life, an increased rate of hospitalization for heart failure, and shortened survival. Pros and cons. Pros. Allow sufficient laminar flow and closure of the cardiac apex by means of a patch avoiding bleeding and complication. Cons. Bleeding, blood clots, valvular dysfunction and replacement valves, heart rate problems, infection and stroke.
When your heart's mitral valve doesn't close properly, it takes a big toll on your health. You may feel tired just walking from the couch to the fridge. We call this condition mitral regurgitation or a leaky mitral valve. To get a better idea of what's going on with the leaky mitral valve, think of the mitral valve as two curtains in front of a window. They're supposed to open and close to block out the light. But if there's a gap where they can't cover the window, light begins to peek through. This essentially is what's happening to a leaky heart valve. When the mitral valve can't close properly, blood can seek back and forth between the chambers of your heart instead of moving efficiently to the rest of your body. People with a leaky mitral valve often struggle with day-to-day living. Their lungs are filled up with fluid, which makes breathing and moving a challenge. They may feel fatigued, weak, and have swollen ankles. For years, the only way to treat a leaky mitral valve was through open heart surgery. Unfortunately, for people who are elderly or sick, it's too risky and simply commonly is not an option. Luckily, over the past 16 years, we have seen the rise of a procedure called Transcatheter Mitral Valve Repair, which uses a mitral valve repair device. Through a puncture in the right leg, we're able to insert a tube that transports the mitral valve repair device to the heart. Surgeons place the repair device, which actually looks like a clip, onto the mitral valve. The two arms of the clip grasp the opposing leaflets of the mitral valve, pulling them closer together such that the valve stops leaking. Instantly, we know if it's working and can make adjustments on the fly if needed. Quick recovery is one of the amazing benefits of this procedure. After open heart surgery, a person commonly needs 9 to 12 weeks to recover. After transcatheter mitral valve repair, patients are often up and walking the same day. They're usually released from the hospital the day after surgery. The Sutter Health Network has made it possible to
Issue applied in Ecuador. In Ecuador, the impact of cardiovascular diseases is quite significant. It is estimated that about 14% of the Ecuadorian population, 1.4 billion people, live with some heart disease. Hypertension, myocardial infarction, atrial fibrillation, and heart failure. Of these, it is estimated that more than 199,000 have heart failure without adequate medical support or treatment.
In 2003, I developed a virus in my left ventricle of my heart. And that's when I met Dr. Jaski at the San Diego Cardiac Clinic and his team. And I've been working with them ever since, until this wonderful new procedure came on to help cure my mitral regurgitation.
So heart valves are just like doors inside the heart. They allow blood to exchange from the top portion of the heart to the bottom portion of the heart, and then to let the blood out of the heart. And traditionally, we would replace that heart valve with open heart surgery. This new heart valve is put in through a small tube that comes in through the tip of the heart. We make a small incision between the ribs, it's around this wide, and then we put in a new heart valve through that incision.
So what they did, Dr. Galaputi felt that I was a good candidate to go in through under the left breast area and kind of deploy, if you will, a little spear gun.
This technology is amazing. It requires a lot of people. You'll see in the room, there's maybe 15 people in the room to set it up and to make it. And then there's this big, long harpoon, it looks like. It's putting a whole new heart valve in through a small tube.
So on June 30th, I went in for the surgery, and I woke up with the new mitral valve.
At Sharp Memorial, we've had a history of having innovation here. We've been the first in San Diego to have heart transplant, left ventricular assist device, open heart surgery, and we continue to offer all of the newest innovative strategies to help out with both heart valve technology as well as heart care overall.
And I really felt that if this could help science and advancement, and personally, if I had any chance at living longer, I wanted to take it. I have a husband I love. I have a godson who is 13 now. A lot to live for. There's a lot to live for.
precaution. Among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite the use of maximal doses of guideline-directed medical therapy, transcatheter mitral valve repair resulted in a low rate of hospitalization for heart failure and lower all-cause mortality within 24 months of follow-up than medical therapy alone. The rate of freedom from device-related complications exceeded a pre-specified safety threshold.
In the United States today, there are about 4 million people with significant mitral regurgitation or leakiness of the mitral valve. Of those 4 million people, very few will be candidates for traditional surgical options.
The MitraClip is the first and only transcatheter device that is used to repair the mitral valve. The goal of the MitraClip is to reduce the amount of leakiness across the mitral valve, thereby reducing symptoms that are typically associated with heart failure like shortness of breath and potentially even mortality.
Here at WellStar, we have probably the best structural heart team I've seen in the state, if not the whole Southeast. Everyone involved in the patient's care, their sole job is to take care of patients who are recovering from heart surgery. And that's very unique to what we have here at WellStar.